In 2021, the California Department of Public Health launched the California Equitable Recovery Initiative, or CERI, to strengthen equity efforts across the state. Local health jurisdictions use funds to meet the unique needs of their communities. We spoke with the program leads at San Joaquin Public Health Services in California's Central Valley to highlight the plans they developed through CERI. This effort guided San Joaquin County's community health assessment and community health improvement plans. A key part of this work included park activation and mural projects created with public and private partners to reflect and uplift the communities they serve. My name is Sharon Wright, the Equity Technical Assistance Manager with the Office of Health Equity at the California Department of Public Health, and in this video, we're spotlighting how these plans and efforts came to life through community partnerships.
My name is Caitlin Pierce. I'm a supervising public health educator with San Joaquin County Public Health Services, and I oversee our health equities initiatives.
My name is Sterling Hill. I'm a public health educator at San Joaquin County Public Health Services working on the Health Equity Initiatives team. San Joaquin County consists of 8 cities. The major city is Stockton. Stockton is the city seat. We also have Lathrop and Manteca to the south, and also Lodi to the north. San Joaquin County is a very diverse county. 2 in 5 households actually speak a language other than English in San Joaquin County. It's a minority county, so very diverse culturally, which really adds to just ethnic diversity that we see.
The San Joaquin County Public Health staff use CERI funds to organize and strengthen their equity plans.
In public health services, our approach to addressing health equity was really informal before the CERI funding came through. We would do activities sort of on a as-needed basis, ad hoc. It was very informal in our programs where we would mostly reach out to our partners in the community when we needed something from them or we needed their input, but it wasn't uniform across our entire department. Once we received the funding, the CERI funding, we were able to formalize those approaches and we were able to educate our entire staff about how we can engage with the community in a meaningful way. After the development of the Health Equity Action Plan, the Health Equity team was intentional about embedding the concepts and measures into other plans throughout the department. The first one that we worked on was the strategic plan for the PHS, for the whole department. One of the focus areas for the strategic plan became health equity work in advancing health equity of the community. We next started to revise and update the quality improvement plan for the department. We looked at ways that we could incorporate health equity concepts, embed an equity lens into programs and initiatives. We also started to look at performance improvement and other program plans in the department for ways that we can incorporate and embed equity lens as well. Sterling and I began reviewing and revising policies internal to the department on what the workforce is doing and how we perform. We also reviewed and revised a dress code policy and made sure that we had cultural considerations in that as well.
Having that face-to-face interaction with some of our community partners, our community residents, I feel like that went a long way as far as strengthening some of the relationships that we built during the pandemic to drive us forward as far as collaborating for health equity.
Together, we collaboratively developed our Health Equity Action Plan for public health, and they provided and guided us on what we should be doing to be able to provide better services.
To better understand what local communities really needed, San Joaquin County Public Health Department worked with community partners to create a community health needs assessment focused on areas with the greatest needs.
We engaged our Resilient Community Advisory Committee, which is made up of community-based organizations, nonprofits, faith-based organizations, governmental organizations, and small businesses throughout the county, which provide a variety of different viewpoints on what works well within health equity. So being able to engage that committee in 2 different strategic planning meetings, plus we pulled representatives for focus groups, and also we did a community listening session to get that community perspective.
In our community, we have 14 priority neighborhoods. We engage with our community partners, residents, stakeholders to identify these priority neighborhoods by looking at health outcomes by census tract. Each census tract, we rank their health outcomes and identify the least healthiest neighborhoods, and those become our priorities for that CHNA, or Community Health Needs Assessment cycle.
These priority neighborhoods are areas where residents are dealing with high rates of illness, unsafe public spaces, and fewer resources because of long-term inequities. Because of this, public health staff started adding an equity lens to their public health planning, so those neighborhoods' needs stay at the center of every decision.
Our senior deputy director is also a steering committee member of the Reinvent South Stockton's steering committee. So she had very close contact with the executive director of Reinvent South Stockton Coalition. So she was able to pick their brains basically on what we would want within our health equity leads, and also what the health equity action plan would look like for San Joaquin County Public Health Services.
My name is R.C. Thompson. I am the Executive Director of Reinvent South Stockton Coalition.
Reinvent South Stockton was very instrumental as far as helping us really lay the foundation for our future work within health equity within the department. So it was a very valuable connection that we feel very grateful for.
After this seed planting with SERI, this is how excellent when our public sector, high-level public sector like California Department of Health, really pays attention to what's happening on the ground. It's magical.
San Joaquin County Public Health focused on changing everyday places that shape people's health.
The 2022 Community Health Needs Assessment put an equity lens to addressing the social determinants of health in the community. We did 29 focus groups with over 300 community residents, and we looked at over 100 health indicators. The top 3 health needs were behavioral health, mental health, access to care, and healthy eating, active living. We then decided to address park beautification as a way to capture and approach all 3 health needs in one strategic approach.
Historically, parks, especially within South Stockton, have been disinvested in.
In past CHNA and CHIP processes, we have prioritized too many activities and too many focus areas and had too many goals to really make a difference in any one key area. So focusing on park beautification and park investment was so important for us. I believe San Joaquin County and Stockton particularly, we rank almost near last in terms of park investment, and it was really an area of need that was relevant and important to our community partners.
A lot of the gaps within the county as far as our health needs we knew would be addressed by strengthening, revitalizing, and making our parks better. So park revitalization was definitely key for our CHIP.
The park revitalization project included a mural with significant meaning in Williams Brotherhood Park that goes beyond transforming community spaces.
That mural painted an African, Filipino, Pan-African colors with Mexican colors. That brotherhood, that central location, is a symbol of unity. It highlighted a population that was being overseen. It also uplifted the work that we did to reclaim the park area. Those murals, they see themselves in them. That's how magical it is. Art is healing.
For San Joaquin County and their partners, this work is still evolving, but efforts like the Williams Brotherhood Park mural are one way they're making health equity real in people's everyday lives.
The level of knowledge and wisdom that our staff has gained within equity has been just invaluable. And I think that's one thing coming out of the SERI funding, we can look back and say that we've really substantially increased our capacity to talk about equity, but also do our equity work in the community in a way that's going to make a transformation within San Joaquin County.
Caitlin shared one lesson that really stood out as they went through this process.
There's always the lesson learned in this at work in health equity. There's no written path forward on how to address the needs of the community because they are ever changing. So I think that's one of the things that we've learned over time is just to be flexible and continue to reach out to the community and be connected with them and figure out what we need to be doing, what they need from us, and how we can educate our workforce and bring our workforce up to be able to do that work and meet the community where they're at.
Through this work, San Joaquin County demonstrated how community-driven projects can build ownership, promote healthy behaviors, and advance health equity. We are proud to highlight this inspiring example of equity in action.